We're scrolling through a CT that was performed of the abdomen in a patient who had a history of renal cell carcinoma. You can see that the left kidney has been surgically removed, and there's no soft tissue mass within the nephrectomy bed. That's one of the things we look at. When we look at the right kidney, we can actually see that there's this mass within the right kidney, suspicious for an additional renal cell carcinoma. The reason I was pointing out this study, though, is I wanted to just take a look at the pancreas. And here you can see the pancreas coming around here. And if we follow it to the body and then the tail here, there's a suggestion that there might be a mass here within the pancreatic tail. It's fairly isoattenuating to the adjacent parenchyma of the pancreas, but it does stick out. And I was just showing this case because I think it illustrates the importance of having arterial phase imaging in patients who have renal cell carcinoma, especially those who have a clear cell renal cell carcinoma, which are usually arterially enhancing. The metastases tend to behave similar to their primary lesion, and so if you have an arterially enhancing renal cell carcinoma, having an arterial phase can be helpful at being able to identify metastases. And here you can see much more clearly this hypervascular lesion involving the tail of the pancreas, consistent with a metastasis from the renal cell carcinoma. But the other part here is, if we go a little bit further down, we can see within the head of the pancreas, close to the duodenum, this other hypervascular pancreatic lesion, which wasn't appreciated on the portal venous phase. And this is primarily because these things stand out really well. The clear cell renal cell carcinomas that are arterially enhancing, the metastases stand out much better on the arterial phased CT scan. And so this is one of the reasons why we do an arterial phased CT scan to evaluate for renal cell carcinoma metastases, especially when the primary itself is hypervascular.